I'm Dr. Mike Miller. I'm a foot and ankle surgeon, board certified with Midwest Center for Joint Replacement, specializing in orthopedic and podiatric care, anything below the knee, foot and ankle reconstructive surgery, anything from ankle fractures, Achilles tendon ruptures, to ingrown toenails and patient care. What's meaningful to me about the opportunity to be a surgeon in medicine is making a difference in people's lives. Foot and ankle surgery is challenging. Leonardo da Vinci said the foot is a marvel of engineering and a true work of art, and it's true. There's 28 bones, 107 ligaments, 30 joints, 31 tendons that all have to function together to get you from point A to point B. The anatomy and engineering is wonderful, and it makes us have to be good surgeons to get good outcomes. The expectation for patient care, the first time they come in, they're going to be greeted by people that care. It's our ministry, our compassion to help people. That's why we do what we do. So what's special about Midwest Center for Joint Replacement is the individuals, the surgeons, and the staff. Fantastic reputation in the community and nationally, and looking forward to a good partnership. I'm the director of our surgical fellowship for foot and ankle reconstructive surgery here in Indianapolis. It's based on reconstructive procedures to train fellows, and it's the way that we give back and pass on that opportunity for education. Everything is tied together, right? And so if you have some type of pathology with your foot or ankle, it does affect your knee, your hip, and your lower back. You start compensating, and that compensation can change the mechanics of other parts of your body. Having that collaboration with the other surgeons, I'll say, hey, I've got a partner who is a specialist in knee or hip surgery, and if you can just pop down the hallway or go grab your partner and say, hey, take a look at this, it helps, universally with patient care. A successful outcome for our surgical patients is at the end when they come up and are happy and leave walking pain-free. It's an opportunity for us to make a difference in their lives. It's a journey. So over that period of time, you get to know individuals and become friends and part of the family, and to pass on the ministry of what we do.